morning, viewers. My name is Binta Jallow from Eco TV, and here with me today is the Director of Health Promotion and Education. Sir, can you please introduce yourself to our audience?
Thank you for coming. Eco TV. I am Modou Njie. I'm the Director of Health Promotion and Education at the Ministry of Health. I'm also the Chairperson of the Risk Communication and Community Engagement Subcommittee of the National Health Emergency Committee on COVID-19 Preparedness and Response.
Thank you very much, and once again, you're welcome to Eco TV.
Oh, thank you very much.
Your first guest on this show.
Wow.
The first question that I want to ask you is, we're going to start with the rumors that are being speculated on social media, or people are saying it in town, which one of them is the frontliners and nurses that are willing or want to go on a sit-down strike on the 12th. And how true is this rumor? And then if this is true, why are these people embarking on this?
I think basically I also heard about it. I was with the minister on tour. We went around to health facilities in Sierra, and then we came to Bansang, and then while he was talking, and then he mentioned it there. But we don't know the reason why they're doing it, but basically it's all linked to the issue of allowances. And then I think perhaps they didn't get the explanation right, or they didn't get the information with regards to allowances, but I think the issue is around allowances. That is what I could understand, but I think what is important is we just need dialogue. We just need to explain to each other what are the issues around the allowances, and then who are entitled to allowances, and if they are also entitled, who should be paid under what category. We have the high risk, we have the medium risk, and we also have the low risk. Those are all identified in the list that has been provided, that was done. So I'm sure it's all around that, but I don't get the real information about it, but I just heard about it, that they want to go on strike. But basically, when I asked, and somebody told me that it's linked to the allowance, but I didn't have the opportunity to talk to any member of the organization that are organizing this strike, which I'm intending to do, to talk to them and find out, because we are all colleagues, if there are issues and there are misunderstandings, so we can just sit down and talk about it and then finish up with it. I'm sure this is something that we can discuss. Perhaps there is a miscommunication somewhere, which when we sit down face to face, we can also be able to talk to each other, and we may be able to clear it out.
Okay, the ministry has received, to what you understand, that the ministry has received a lot of monies regarding this COVID-19. How far have the ministry gone on the payment of these nurses? And then also, these nurses are even complaining of discrimination. That is, some people have been paid while others have not been paid yet. And then also, these monies, how are they spent, especially when frontliners are complaining of lack of PPEs rather?
Yeah, I think what I could understand, though I'm not in the procurement side, and I'm also not at the admin side and so on the economic side, but what I could understand that an amount of about 160 million had been spent as of now, according to the Minister of Finance and Economic Affairs. And if we look at the background, most of the one is about capacity building, the other is about equipment, and all is about procurement lists that have been provided. And now we're with about 100 million is going for procurement of medical and other equipment to strengthen health system. That one I'm aware of. Then 60 million goes to accommodation for quarantine facilities and the treatment center, and as well as the vehicles and so on. So a lot of things have gone into that. And then I'm sure when you come to procurement of PPEs, what is important here is the PPEs, as far as the information I got, that they are available in the store, in the central medical stores. What people need to do, they need to request through their various authorities. Like if you are in the region and you are in a health facility, you need to request through your regional director, who will endorse, and it come to the Director of National Pharmaceutical Service, who is the chair of the Logistic and Security Subcommittee of the National Health Emergency Committee. All these requests have to come to him for approval, and then distribution of the equipment. That's how it goes. And now these are the procedures that it must be followed. Like if you want to sit in your facility you don't have, I think what is important is for you to now talk to your authorities, and then those authorities now will have to make a request on your behalf. And then when the request comes to Banjul here or Kotu, it is also looked at, and then they also enter, because as you know, we are operating in what we call the logistic management information system. And this logistic management information system, if we make a request and it has been come to this level, it will be entered, and when it has been supplied, it also follow it up from where it goes. So this is the beauty of the whole logistic management information system. So I am sure what they are talking about, perhaps people don't know that there's certain things are available at Central Medical Store, but when we make a request, if certain people will come here and then I'll give them advice, and then when they make requests, they get what they're supposed to get. It's just some people are not requesting, and that is why these materials are not given to them.
Thank you. How far have you gone in revamping the facilities? I mean, like these facilities, the quarantine places, because people are complaining a lot that they are not in good condition.
Oh, I think you missed that one of our trip. What was about Wednesday trip? We went with a large number of media fraternity. We visited Badala Park, and we wanted to go to another site, which is Bamboo. And then, but what happened is currently, they went to Badala and they spoke to people who are working there. And then I think that's just people just want to say what they want to say, and then they have the right to say what they want to say. But if we look at our facilities, we are very careful when it comes to selection. We make sure that before a hotel is selected, we have to get certain criteria, and then the hotel accommodation should be of standard. It should have television, air conditioning, internet facilities, and these are all things that are within the facility that we are providing. So if people say that it's not suitable, that is their view, and we don't want to go against that. But our opinion, anybody who want to have the first-hand information with regards to the facilities we are providing, you can easily come here, or we just go to the facility and you just give us a call, and we can connect you to somebody who is working at the quarantine facility, and you can go around and see our facilities, and then you can now speak for yourself. So, but really, what they are saying is their opinion. They are entitled to their opinion, and then whatever they want to say, we are okay with it. But our facilities are really, I think we are doing what we can, because we make sure that when we put people in quarantine, certain facilities are provided. We have psychosocial support is provided, medical services are also provided, and then they also allow them to do some walk around exercises and so on. So whatever thing people don't expect, these are facilities we are providing at people on quarantine. Okay. And they can be attested to. Anyone who want to go there can just ask, and then the Director of Public Health Services will be able to lead you into one of our facilities.
Okay. Yeah. Okay. The Minister of Finance, the Minister of Health, I think, or Finance, said at the National Assembly that already 160 million has already been spent. Some people still in doubt as to the amount. And what's your reaction to this?
Yeah, basically, I don't think there should not be any reaction, because this is exactly the information that is being collected with regards to expenditure. Most bulk of the money has gone into procurement of procurement is the arrangement of accommodation and facilities arrangement, and not only here. Basi is also one of the things we have also arranged for a quarantine center. We also have certain expenditures in regards to feeding. For certain thing, and also training, capacity building also is part of it. I cannot know exactly the breakdown, but I think what I can understand is that out of the 60 million also, that's where vehicles are also 8 vehicles have been procured from that particular 12 million. 60 million. The 100 million is already put aside, because what happens is, like when you want to do procurement, you prepare a list of items you want, and that total cost of the items and equipment, that is what is costing $100 million, and that is what is put aside. And the 60 millions are the other expenditures that have taken place during this intervention.
But the public are really complaining, saying that the ministry are using this money, or huge monies, to put on these hotels in quarantine.
Yeah, in fact, yes, that is our opinion, as I said, but if you look at it, yes, the money is good to be put on the quarantine, because why we want to do quarantine is that we don't want people to be taken to facilities where they don't appreciate and they complain. We want to make sure they are provided the standard facilities, accommodation, feeding, and all those things are part of that. And then we all make sure that we provide psychosocial support. We make sure we provide certain preventive measures, like certain medical doctors are available and nurses who are also there to give them services, especially those with other conditions that are not related to COVID-19. So you can see that a lot of work is happening there. So we don't want them to miss that opportunity that they are supposed to have, even while they're outside that quarantine center, which they have been having before. We don't want to give them like 100%. We cannot give them 100% of what they need, but we are trying to give them at least close to 90 to 95% of the services that they require. And I think most of them have got that. I know, remember that at some point we are in one of the quarantine centers, we wanted to discharge somebody, and the person definitely said he doesn't want to go because he was enjoying our facilities. So you can meaning that we have been providing what we are supposed to provide for them, and they really enjoy the facilities. And notwithstanding, our staff are also with them, talking to them. No one is left in isolation. They have been taken to the interacting with them. So this is something that we were expecting. So I don't think, in my opinion, that money is too much. And then also we now think of having moving into community sensitization, community engagements. Perhaps that will be another phase of the money and the spending of the money in terms of that area. But I think basically that's the opinion of the Republic, and then they are entitled to that, and it's democracy. Anybody can say anything you want to say, and then you have just come up with your opinion. But I think, in my opinion, the money has been spent where it's supposed to be spent. Well, otherwise, it is the same people who will come back and say you did not provide better facilities for our people on quarantine. The same people will come back and complain again. So it's important
because they were complaining.
That money is expensive. But when you don't do it, also they will say the facilities are not. And then remember, during the beginning of it, at the Golden Beach, a lot of people complain about that, because what happened is, like, somebody come from Europe, they ask you to be on quarantine, you want to see your family. So some of them were trying to make certain excuses and certain stories so that they will not be taken to quarantine. But with all that, we have to take them to quarantine. And because of that anger and that frustration, some people have to go and start tarnishing the image of the Minister of Health. Some even went to the extent of saying that the ministry did not welcome them at the airport, which was not the case. The Director of Public Health Services was there, the Permanent Secretary was there, the Acting Director of Health Service was there to receive them at the airport and also take them to the quarantine center and give them all the support whilst they are on the ground. So I think, and people went around again to say that they were not around. So it was only me and the minister who were not there at that time, but at least the rest of the people were there. Yeah. Because we were engaging in other things at that time.
Okay. Yeah. Mr. Njie, you embarked on not a nationwide but a rural area tour to visit health facilities. And in an interview, we had the minister saying that some of these health facilities are not in standard. Yep. Why do the minister say that? How did you find the health facilities in the country?
Yeah, actually, not all facilities, but at least most of the facilities, they require rehabilitation and complete facelift. Like where we visited three places. One in Kerulde, and Kerulde, as you know, is in Upper Salem, and then home village of our Honorable Ahmad Ba, where he come from, and then there is a philanthropist that is also they are constructing a massive health facility for that particular community, and there are about almost 50 communities are in that area who are visit. The minister was able to go in and see the facilities, and then he made some recommendations in that facility, like which were not in the plan, like improving ventilation and also ensure that there are sanitary facilities like the taps, how they should be, like where the tap should be in the assessment room or the screening room, that should be tap in the labor rooms and labor wards and so on. So all those discussions were done, and then the contractors really appreciated that, and then they promised to adjust based on the minister's recommendation. And then we moved to Njao. As you know, Njao currently have a community clinic, and this community clinic, yes, ministry is also planning to have a new structure in Njao, a new major health center, and it's going to be built. But prior to building that particular health center, now, because last year the wind blew off the roof of the Njao Health Post, and then the community had to intervene and then make some adjustment on that. But withstanding, the building is still in a bad shape, and then it needs to be rehabilitated. We built the accommodation for the staff and as well as where the staff are working. So the minister felt that there is a need for expansion, and then that expansion, we need to have that community health facility, community clinic should definitely be expanded to another level. But before moving into the major health center, the existing facilities need to be refurbished, and that is why we are there. And then a tune of about $3.6 million plus. And then why we are doing that here, and in that rehabilitation, there's going to be another structure again, another new structure that's going to be built within Njao. And then Njao, as you know, if we pass there, it's not fenced at the moment. So the fence, it's collapse, and then they get the toilet facilities are not deteriorated, and then they are not functioning. So a lot of things are happening there. So that's why there is need for the ministry to intervene, and that was why Minister requested for Minister of Finance to support that period. And then I think it's coming through the vote with the Minister of Health, and this is a very good initiative. And then even whereas the committee decided to have, because the other land is allocated, and for the construction of a new major health center in Njao, because Njao is in Upper Salem, and then it is the only facility in Upper Salem area that doesn't have a health facility. So that is why the minister felt that there is a need for that area to have a major health center, which will also support the Lower Salem facility, which is Kaur. And then if that building is also completed, now the existing one now will also be turned into staff quarters. So that is why, and then other areas like, for example, staff quarters plus a reproductive and child health services, where women will just come for immunization, for weighing and other things. That can happen in that particular area, whilst the major health center will focus on other aspects. So this is the idea. And then we moved to Wuli Nyakoi Caravan, and they also have a sort of a health post, and this health post is also in not a good shape at all. So the minister felt that the place needs to be fenced, and it's also not fenced. So based on that, a proposal was also submitted for that place to be fenced and to have a new structure, and also to turn that old structure into a modern structure. And that is interestingly also in that facility currently there is no water supply, and in that particular contract there is going to be a borehole for the facility, so which the community really cherishes. They really feel very happy with that. And then from there we went to Bansang Hospital, where the minister also handed over the contract about $500,000 project contract to expand the dialysis center, and because Bansang is going to be for the first time a community or rural hospital is going to have a dialysis center, hemodialysis center, and this dialysis center is going to help in the management of other major conditions like kidney and other kidney failures and so on. So therefore, having that one in Bansang will also help all the communities in the Upper River region and also all the communities in Central River region to use those services instead of coming to Banjul, so that when you go to the facility and then you take your treatment, and then you can go to your village, and then after you're doing your appointment again, you can also come back and continue with the treatment. So that's the essence, because many people travel from far distance to come to Banjul, and then sometimes minister felt that he was explaining, that certain people will have to go and then squeeze with other family members around Combo, and which sometimes if you don't have a family member here, you come from Basse, you find it very difficult to be so these are things that he put into consideration. He said, okay, there's a need for us to have one in the upper end of the country, so that those people can benefit, so that after getting their medication, they can easily go to their village and then come for their appointments very easily without having the trouble of traveling up to Banjul here. That was the sense of that particular project. And similar of those things will come, and there are similar things in the pipeline. The expansion of Basse District Hospital, operationalization of Soma District Hospital. SL is already almost had the contract has been handed over about almost a tune of about $9 million, and also we have other district hospital like Brikama is also going to be expanded and upgraded. So a lot of things are happening at this point in time. And then after all the construction work, they're going to be like given the required staff and equipment, and so that most of the facilities now, then Kanifing and Banjul EFSTH will now have a reduced workload in terms of patient flow. So this is exactly what we are trying to do at the ministry.
Tell us the availability of ventilators.
Actually, the information we got at the beginning was that the ventilators that we came into the donated were about 10. That was what the information I got some time ago. But when we consulted, I think there were 2 at the moment, and then the rest are not actual ventilators, but the medical doctors will be able to tell you. And when I asked some of them, they gave me a different name which I couldn't remember. But now they are not actually, but the 2 are really functional ventilators. But at this point in time, their usage is very, very low, because what happened is like the patients where we have now, they don't those people don't require, most of them, I don't think they will require ventilators. So what they know now, because they are stable, and then it's only required for people who are finding it very difficult and they need intensive care. And then most of our patients we have, they are not under intensive care, and that is the beauty of the whole thing. They have been managed by our own doctors who are specialized in those areas, and then definitely we are very grateful to those doctors who are really managing those people, because they have the right skills and competence, and that's why we are not having those people to go into intensive care.
But don't you think the availability of ventilators is important, because you never can tell. People have the symptoms at home. Some of them, because of the discrimination, they might prefer to stay at home, and then before you know it, things get worse.
Yeah, that's why they're very considerate with that. I said that's why those equipment I was referring to, they're also about 10, and they also facilitate, trying to ensure that they help in the breathing process. But it's not purely for ventilators, but also can also be facilitated in the work that the ventilators can do. So the doctors will be able to tell you the different purposes. But as far as we are concerned, we are also considered in that one. That's why we are expanding our facilities. And then among those materials that are to be procured include ventilators. And there are many in number, so I couldn't remember exactly how much is the number, but the ventilators are also there in large numbers, so that you can also be able to have ventilators across the country, from Deban Clinic when it is completed. We have a sanatorium, the one in Sukuta, Soma, and others. We all have ventilators in preparation for any other eventuality. Even after COVID, they will all be there, and then they'll be serving other purposes.
People might be saying, reaction of people, and especially on social media, you see all kind of reaction.
Yeah, exactly.
So what baffled me is some of the reactions that I've saw on social media. Some people are saying that in bigger countries, in larger countries that have all the facilities, they have people dying like every day, but in the Gambia here, still now we can only count one death. And then even some people are saying that one was not, he didn't die from COVID-19. And the question now is, how are these treatments done?
It will be difficult for me to say how the treatments are done, but what happens is we treat the doctors there are treating other underlying causes and factors, and as well as other symptoms, like for example flu, the fever, and all those things. They make sure that they manage those ones on time, because they don't want to delay, and then the moment there is delay in management and care, automatically it results in other conditions. So when they look at you and you feel, for example, they have you are already COVID-19 patient, and then for example you have diabetes or you have hypertension, they manage those conditions around. And they also, for example, if you have flu, high fever, and so they also try to manage that one. So this is exactly how it goes. As I told you the last time, COVID-19, there's still no specific cure for the virus, but that's what you can do. You need to just treat the other underlying factors, like for example fever, coughing here and there. If somebody's coughing and sneezing, you just make sure that you make some some medicines for those ones. So now,
does it mean those people are cured totally from COVID-19?
When they are before they are discharged, they're taken, their samples are taken, and then automatically when all other underlying causes, because certain conditions can aggravate a disease. So at the other conditions, like if you are able to treat all those ones effectively and efficiently for that matter, automatically you can also be able to reduce the power of that particular virus, and automatically it will be very ineffective at that point in time. So that is what we are doing at this point in time, and I think as I tell you that they are doing all what they can do to do more research on the actual medicine that is going to be used for the cure of COVID-19 globally. So WHO haven't come out clearly to say this is the actual medicine that can treat it, but what they are now doing is to treat the underlying factors around COVID-19.
Okay, so there is no cure for now. One can say.
Exactly.
Okay, so those people who have been discharged also are free from COVID-19?
Well, when they are discharged, before they are discharged, they are tested, and then when they are negative, and they allow them to go into the communities, meaning that they can all be able to transmit person with the virus. That's the confidence, because that's a confidence level.
So how are those people within their community? Because we believe the Gambian mentality, sometimes some people tend to discriminate people who are sick, especially if you hear someone suffered from COVID-19, coronavirus, and people will start to say, in Mandinka, so people will start running away from them. How are those people managed?
Actually, there's always follow up. Like when they are discharged, there is team that also follow them up to monitor them to see whether they'll also be able to manifest any other signs and symptoms. That normally is done about 2 weeks or so, and then they keep on following them to see whether they'll also manifest any other condition. If there's any other condition, they just continue to manage those conditions and symptoms. But if you don't show anything, then automatically they allow you to continue. But what we are asking is a very important question. Like in this country, even certain families are described as hypertension family or diabetes family, because in this country, whatever condition that a family has, automatically they put a stigma on that particular individual. It's not only about COVID-19, but it's about many other diseases. Like even tuberculosis, one person having in a family, automatically that particular family has been stigmatized. It's naturally, that's what happened in the country, which is really unfortunate, that no one buys a disease, no one wants to have a disease, but it happen, we should not discriminate or stigmatize against them.
Great. So in this case, what is the ministry doing to sensitize people, and to raise awareness?
It's one of the activities is this one now, because we know we are telling people that the people should not be stigmatized or discriminated, and also people should not still continue to live in denial. All this is about they need more information, they need more communication activities to be geared towards them, and that is why media and then our office will work very closely to ensure that we start to say more about the disease, and also to educate the family members of those people who have been discharged from hospital and they're already at home, for them to make sure that they adhere to the rules in managing those people, so that the rules are they should not be discriminated or they should not be stigmatized against whilst they are
This brings me to this question. You are working closely with the media, but do you think only the media can disseminate this information? Are you trying to work with other sectors also? Let's say, for example, the creative industry.
Thank you very much. That's a very interesting question. If you talk about media, there are 3 types of media. One of them is print, where you have the posters, the leaflets, and so on. You also have electronic, and also you have traditional media. And the last question also refers to the traditional media, cultural troops, and so on. What we did also, we were able to map out some community and some groups, either traditional communicators or community drama groups, or drama groups in general, or poets or whatever, and they brought in some materials, and we spent a lot of time reviewing those materials, like either it's a song or a drama or a poet. We are able to review them and also give them points, and those points we are able to advise the ministry as to how best they can be supported, so that those videos are already with us, compiled list of videos and audios with us and poets, and these are the immediately we cannot release them now, but immediately after the COVID, after paying them or after giving them a token for their services, then we can also be able to air those ones on them. But they are ready for them to be taken to air.
But they are not paid yet, so
yeah, that's why because we don't want to commit ourselves to give them to air their things that we didn't give them any compensation.
So when are they going to be paid?
We are in fact finally on that process now, and we got some partners that are going to support them, and we hope that it will also come from the COVID-19 funds. But we're trying both angles, and I'm sure before the end of this week we're going to get something very clear on that one. But we are really pushing very hard because we really want to motivate them, and that's the way. And then it comprises of so many cultural groups, so many of them, and they're beautiful songs, beautiful drama, and then messages. And then interestingly, when they were doing it, some of them were looking at our old messages. And when they came in, because we are changing, risk communication is real-time information sharing. So anytime situation changes, you also change your messages. So now that we are doing that now, we're also trying to focus on the issue of people, social distancing, or physical distancing, and also avoiding public gatherings and so on. These are latest messages, and now we are also focusing on stigma and discrimination. So you can see that these are the messages that are already in our message. So we are changing from hand washing. No, although hand washing we still promote, but we are still changing on that one because of the fact that the messages are still a bit, old, but we are still trying to use them bit by bit, injecting them. But our focus now is stigma, discrimination, and as well as also messages to address denial, and as well as the issue of physical distancing. These have been our messages, and avoiding public gatherings.
Okay, yeah. So I want to read a task that we gathered, and one of them says IMF reached an agreement of 47.1 million US dollars with the government of the Gambia from its extended credit facility. The government of the Gambia in response withdraw 25% from the Central Bank of the Gambia, that is domestic loan, which will have to be paid back by the government once the IMF loan arrives. And this was done without Parliament's acknowledgement or approval. The government's position is they are following a trend which has been practiced in countries ago. So, however, the government of the Gambia violated Section 155 of I don't know, 3. I'm not very good in in the sections and the of the 1997 Constitution. What is your take on this?
Thank you very much. This is something very interesting question, very interesting concern. But unfortunately, I'm not the right person to answer that, because that doesn't fall under my purview. Because when you talk about health, I can say something about it. When you talk about finance, that's a challenge for me. So maybe the Minister of Finance or the Permanent Secretary or somebody else at the Minister of Finance would be the best person to respond to this query or concern. And basically, this is something that I have no idea about. Yeah, okay. I'll be very frank to you. No, it's not that I don't know,
we should keep this question to the Minister of
the Minister of Finance or
Finance.
Yes, this is a purely finance issue.
Okay.
So I would really advise that we will forward it to them. I'm sure we'll get the answers.
Sure.
Yeah.
We'll make a follow up on this. And so let's talk about the seriousness of COVID-19 in this country. Social distancing is a problem. Yep. And I myself can attest to that fact. Even in the cars and vehicles that you said, okay, now we are saying that they should take half of what they take. There are certain people still now they're violating that and that thing. So in the markets, for instance, you go to a market for shopping. I mean, there is no social distancing at all. What is the ministry doing to make a stop to this?
Actually, as you know, this COVID-19, we have several subcommittees. We have a subcommittee on risk communication and community engagement. We have a subcommittee on logistics and security, another one on laboratory and surveillance, and the other one psychosocial support, as well as coordination and case management. All these subcommittees have a role to play. And then if you look at logistics and security, the securities are represented in that particular committee. And they are the ones enforcing the state of public emergency regulation. And in all its form, that regulation must be, implemented by the people, but the enforcement agencies are the security agencies. That's why they're in that committee also. They're also doing very well. They are arresting. I know you are aware that some people are arrested on the beaches, on the KMC and Banjul, because of the fact that they are trying to implement the state of public emergency regulation. So therefore, we get the support of the security, and we just want the public now to give the support, to give all whatever support they can to give it to the security, because they are implementing the state of public emergency regulation. And then it cannot be done effectively and efficiently, for that matter, without the support of the community. So we want to appeal to the communities to do that. The securities are doing that. And as well as also the securities are also moving to sensitize the public, and then they're also working on community sensitization, especially on the borderlines, and also in the markets. We also are aware of the fact that the councils are doing what they can in trying to talk to the people in the market, trying to sensitize them, using their other structures to be able to facilitate the implementation of the state of public emergency regulation. So the councils are there, but it's the people that need to change their attitude towards the state of public emergency regulation in its all form. It must be respected.
Do you think this is implemented? Because people are not really respecting.
It's a challenge. That's what I'm talking about. It's still an attitude of the people. Like, you know that if they ask you not to do this, if you do it, then you are now facilitating the transmission of the disease, and you are still doing that. I think this is a big challenge, and so therefore that challenge lies outside the Minister of Health. A challenge lies government, also outside government, because what government is able to do is to come up with a declaration, and that declaration, it is the people now to accept that declaration and to implement that declaration, but the people are not doing that. So, meaning that they want the disease to come, and they were attaching all sort of issues on this, So therefore, that cannot help us. We need to make sure that we adhere to the state of public emergency regulation for us to be able to address the issue of COVID-19 and its transmission in the country. Otherwise,
do you think?
Because right now it's very scary. We have about close to 9 local transmission, which is a big threat. So, meaning that you can have transmission within the country by even getting in contact with somebody who has the virus, either knowingly or unknowingly, and then you can also infect yourself without even that person not having any history of travel outside the Gambia. So that's a big concern. So people need to definitely adhere the state of public emergency regulation, and as well as the physical distancing. When we say, avoid, being close to each other, avoid going to crowd, avoid programs that will attract crowds, I think people just need to do it for the sake of promoting their health and for the sake of preventing the disease to get into the country. So this is something that we want the tax the communities to do that. The other issue is like the issue of denial. Many people are now sending audios. Remember, people are making audios, people are making videos, sending to people to discourage them, to tell them this disease doesn't exist.
Yeah.
If it doesn't exist, I was watching one television program from I think Latin America. It was so sad that every time you see, they had mass graves. They had to dig mass graves, and they have to put coffins. You bring your coffin, you put it there, you pray for your dead body, and you go. Another one you bring, and they keep on a lineup. I've seen that in so many countries now. And then after when they all leave, they have to put sand on all the coffins for this. So you can see people are dying of the virus, and you are still saying it doesn't exist.
Some of these people are saying that they believe that the virus exists, but they don't believe it exists in the Gambia. And this is a problem because a lot of people are firmly saying that they believe that there is no coronavirus in the Gambia.
That is their opinion, which they are entitled to. But I'm sure if they see somebody with the virus or somebody is with them, they will run away. I'll give you one typical example. One imam once told me this when we were having this COVID sensitization. He told me that if we want to know that people really believe this virus, but they just want to, just to deny for the sake of being denied and for them to be recognized, just go to the mosque. While the mosque is full, that was his example. And he said when this mosque is full, when the imam is about to call for prayer, for people to start praying, and then they start to make up their lineup. And he said just send 2 security officers there with their uniform, and they just tell the imam, can you please give us 1 minute? We are chasing somebody who is from quarantine, who has COVID-19 virus, and is with us in quarantine, but they escaped, but we are told that they are in this mosque. He told me that after that you will not see anybody in the mosque. Everybody will run away. So this is a very classical example I always want to quote. People believe in it. They just want people to say that, so and so is being heard. They want to be heard, they want to be seen. It's okay. That's their opinion. We have no problem with that. But to us, the disease exists. It is new. Not much is known about the disease. So it's important that we prevent ourselves. And we also try to practice hand washing at regular time. Because hand washing, Binta, it's not only about COVID-19 prevention, but hand washing, according to research and findings of research, indicate that hand washing cut down diarrhea diseases up to 50%. It also cut down pneumonia up to 30%. So meaning, if you are able to do hand washing, we cut down diarrhea diseases and as well as pneumonia. And now adding to COVID-19, we can prevent COVID-19. So
COVID-19 virus.
Everyone is vulnerable. People we are saying is the elderly, but now most of our age group are in their 20s, in the 80s, even 7 months old. Baby have in the Gambia.
In the Gambia.
7 months old. So no one is spared. Not male, not female. Everybody is prone to the virus. So the most vulnerable people are everybody. So therefore we should be very mindful and also know where to go. If we have to go out also in public, just can put on mask. It's also very good. Yeah, because I know people will not be able to adhere to because the attitudes that are here, but they want to be, gradually the police are enforcing. And they'll be getting people. And when they start arresting people, the same people will start to say they have the right, they cannot be arrested. You know, this country, people are free, they can say anything.
That is democracy.
That's democracy. That's the beauty of it, but that's also another bad side of it. Because whatever you do, people will criticize you. And when they start arresting them, they start making noise. The government is that, the government is that. The government doesn't apply the laws. Remember when the borders were not closed? You were here. A lot of noise around. When are we going to close the borders? When the borders were closed, they were making noise. This border should be open now. We are tired now. We know nothing is happening. And the same people are now sitting. Some people are sitting at the border, helping people to come into the Gambia. Some are also standing at the border, helping people to take food from Gambia to take it to Casamance or Senegal. So you can see how people are, how funny people can be.
Yeah, because this brings me to this question. People were like saying that they said they closed the borders, but why are we recording more cases?
You see, exactly, all those people who came in, they came through unofficial borders. Unofficial borders. You know, we have 9 official borders, 9. And these unofficial borders, they can cross anywhere. They can cross anywhere and come into the Gambia. So you can see they came, and then we were able to get them through our 1025. When the neighbors or other people call, where they came through, when they called, that's the time they were able to get them. So and people were hiding some of them. Imagine. And most of the people, about 2 or 3 or 4 or 5 people who were taken from quarantine are the people who are affected. And we have to quarantine them. Mandatory quarantine. They cannot go anywhere until they finish. And then when they come in, we make sure that we put them on quarantine, you know, screen them, and then also before they also live in that quarantine, also we screen them.
So after these people being found wanting, that is, these people coming in without being noticed, and after the calls, do you guys try to, let me say the government, do they try to put security forces around those areas, at least to safeguard the people? Exactly,
that's what we are doing. Right now, if you go to Tanje, it's been, you know, controlled by the security. Go to the beach side, it's all where people will just bring people from Senegal through the river, the river. They're all being controlled now. And now you go to the other entry points. Now securities are now doing what they call border patrols, and border patrols have started. And then anyone who wants to risk, you know, coming in, they'll be arrested and taken to quarantine. So anyone who comes in will be known, because people are now on alert. Because what happens is, like, we put up a system in certain communities, like we were able to use certain communities as community vigilantes. And these vigilantes are comprised mainly of youths. And then the typical example we borrowed from Sabi in Upper River region was that they have youths, and then, you know, Sabi have about 8 exit points to Casamance. So they are able to get youths in all those 8 exit points, and then the village development committee support them with fuel and other. And then when they get people, they call the police, and the police will call them, and they take them to the nearest facility or quarantine. So you can see that the police are working together with the communities. And we also thank IOM, International Organization for Migration. They recently concluded training of village development committee members, village heads along the borderline of the Gambia. So we even have some participants from other communities, but all those focus was on the borderline communities, and they were able to do an extensive training and full of demonstration. And then that has also helped us a lot, because that we are now also trying to strengthen, that training was able to strengthen community-based surveillance. And as you know, community engagement, community sensitization and risk communication, the overall objective is to strengthen community-based surveillance. Because when you educate people, they are aware and they can also be active in searching for cases, and that's what we're trying to do. And then that training was also very effective. And currently they're in Central River region, and they finished with Upper River region, North Bank East, North Bank West, and now in Sierra, and then they come to West Coast, the Brikama region. So they are doing a lot of work around the borderline communities.
Okay, thank you. So before the end of this interview, there is this audio that is circulating, and I'm sure you heard what the woman was saying on the audio, that she has a friend at MRC who confirms to her that we have thousands of people with coronavirus cases in this country and they are roaming around. What's the reaction of the ministry?
No, actually, I was told about this audio. I didn't lay hands on it yet. But again, after 2 days again, I was also told that the same audio was also something that the same person countered to say what he was saying was in. That's what I was told, but I didn't lay hands on the two audios yet. But I requested for someone to help send them to me then before we go into our press release. Yeah, but you know, as you know that anytime we have information, we act on it. Like the other issue with regards to the audio and other information on social media with the issue of the vaccine trial. That's what we did. We investigated and we had to mount and you know, a sensation on that. So these are things we do. So when we get the audio, we're going to listen to both of them and then see how we can react.
Do you think people are willing for testing because of this vaccine issue? People are saying, "Oh, okay, if I go, they will give me this vaccine so that I will have the coronavirus." Do you think people are really willing to go for testing?
No, they are willing. What happened is, like, we're able to, you know, then they didn't know that the procedures of testing. They thought they're going to take blood or whatever. And wherever blood is involved in this country, people take it as the side purpose. So, when, you know, anytime you take blood, oh, they'll take my blood. Even to take a little bit, they'll say they've taken all my blood. So, but that's why. But we have been able to demonstrate to people that they don't need to, they don't do any blood test. They just take a swab of behind the throat and also in the nose, and then that's it. That's a sample. That's why they call it the sample. Nothing else. So automatically, there's nothing like needle or wherever. You don't see any needle. So that will show you that this has nothing to do with vaccine trial. So, and also, as far as I'm concerned, I haven't had any information from the ministry to say that they've gone into partnership with any individual or institution to come and conduct research on COVID-19 in the Gambia. I've not heard of it. And the government did not go into any agreement with any institution or individual to conduct COVID-19 research in the Gambia. Not to my knowledge. And it's not something that is happening. If it is true, we'll come back and tell people it's true. But if definitely it's something that we have not got information on that. And it's not something that is happening.
Thank you. Finally, what is your final advice to the general public?
Binta, my message to the general public is to adhere to, for people to adhere to the state of public emergency regulation, and as well people to practice social or physical distancing, and as well as also to practice on hand washing with soap on a regular basis. And let's avoid using social media information. It can be useful at some point, but not all information that are there are relevant. So therefore, any information you want to know about, just contact the Minister of Health using our 1025 or your minister, or you can use our Facebook page or Twitter, Minister of Health the Gambia, or at MOH the Gambia. Then you can also be able to get us, and you can even contribute and ask any questions, or we'll be able to give you the responses as required.
Thank you very much.
That is my message to the general public, and I think we need to also make sure that we practice, in as much as possible, physical distancing must be practiced. And if you are going to public also, outside your house, we need to put on masks at regular times. Very important for all of us, and another way to prevent the disease.
Thank you very much for watching. This brings us to the end of this interview with the Director of Health, Promotion and Education, Mr. Modou Njie. My name is Binta Jallow from Eco TV.